of vomiting or nausea. Let me just think about, okay, severe headaches, some blurred visions, sometimes poor reflexes.
That's imminent eclampsia.
Yes, yeah. So rapid weight gain, you can get some epigastric pain, but you know, I'm going to ask Dr. Bhorat
But
to
Dr. Bhorat, you know, I mean, weight gain and pregnancy, it's already the body is going to be increasing weight because, you know, the woman's pregnant.
Exactly.
So what are those small details that someone who's pregnant should look out for to say, maybe I need to go for a checkup and have that scan sooner rather than later?
Look, I think everyone swells when they're pregnant. I mean, there's no doubt about that. But I think if it's excessive swelling, I mean, you know when it is excessive. You know, you can see your feet are getting really big. I think in that case, then you should go get yourself checked. If you are developing proteinuria, then, and your blood pressure is threatening to go up, that means you are starting with preeclampsia. So I think those are cardinal signs that you need to look for. And of course, if you've had a first trimester scan, or if you had a second trimester scan, we can predict whether you are at risk for it. So if you're at low risk for PE or preeclampsia and you've got a bit of swelling of the leg, you've got no protein in the urine, and everything else is looking okay, we'd probably think that's not important. So you've got to assess the patient holistically. It's not just looking at one thing at a clinical sign. You've got to look at flow velocities, the clinical assessment, the ultrasound, the growth of the baby, the fluid around the baby, all of those things. All those things fit in. So I don't think people should look at one thing and say, yeah, look, if you've got extra swelling, go get yourself checked. But it doesn't mean that if you swell every single time, it's going to be PE or preeclampsia.
That's an important point. So let's say if, you know, someone has onto their third pregnancy and, you know, the first two, there's been no preeclampsia. Could there be a chance then?
Sure.
It could develop in the third one?
Absolutely it can. You have the same risk in every single pregnancy for whatever the rate is for where you live, either 5% or 10%, whatever the case may be. But if you've had preeclampsia in the previous pregnancy, your risk for having it again increases.